Good morning, everyone. Good morning. Thank you all for being on time. I see we have about 173 folks already in here and had about 357 registered. So thank you all for joining us for the COVID test and services received report training. This is in partnership with Dishes and TEA, and we'll be today covering the form and all the logistics for the form and just the different details. As with any other webinar, this one is going to be and is being recorded and will be posted along with the slide deck within the next 1 to 2 business days. And so if you've missed it, if someone's missed it, or you want to go back and review it, you can. It'll be there for you. Just want to emphasize that this is about the COVID test services received report form. Anything else in terms of the testing program, unless it's related to the form, we're going to table for another time just because we want to stay focused. The last thing I'll say is there will be a Q&A segment at the end, like all of our webinars. And so as the webinar is going on, please type in your questions in the Q&A chat. With that said, I'm going to turn it over to my colleagues over at Dishes to begin the webinar. Thank you, guys.
Good morning. Can you hear me?
Yes, we can hear you.
Okay, great. Good morning, everyone. My name is Shannon Richter, and I'm the Analytics and Information Management Manager with the Texas Department of State Health Services in the Regional and Local Health Operations Division. This morning, I'm going to walk you through one of the reporting requirements for the Reopening Schools grant, the COVID-19 Test and Services Received report. First, I'd like to start by thanking all of you for your patience and flexibility as we transition to a very different testing program than what you used last year. As we were developing this training, we identified some opportunities for improvement with the reporting form. We haven't yet implemented these, but I will mention them as we go through the report. So what are we covering today? We're going to be looking at the big picture of the administrative parts and processes of this grant, some key things to know about reporting, the actual test report. We'll have a demo, and then as Damon said, we'll do Q&A at the end. So, big picture. You may be asking yourself, why is this report necessary? There wasn't a similar report under last year's program. The answer to that is because under last year's program, the Abbott Buy Next Now kits that were provided free of charge from FEMA. The products and services being available this year are provided through the American Rescue Plan Act of 2021, and funding is being distributed through the Centers for Disease Control as a grant. As you may know, grants come with lots of strings attached. The Texas Department of State Health Services was awarded $803 million. That's a lot of money. As the grant recipient of those funds, DSHS has the responsibility to be good stewards of those funds and ensure proper reporting requirements are met that were outlined in the grant. We need to ensure that we only pay for what is received and that the schools don't spend more than their fair share, as was determined by their allocation. Just as I'm sure you all carefully reconcile your bank accounts each month, and when you order something on Amazon, you always make sure that you received what you ordered and you only get charged for what you received, DSHS needs to do the same. So imagine your DSHS and you have to reconcile hundreds of thousands of dollars from different vendors that are related to over 2,000 school systems. It's going to be a lot of work and we need your help to do it. So let's briefly talk about the process. The process begins when a school system places an order with a vendor. The order, ideally, school systems will order tests and services just once a month for baseline testing needs. We know there will be exceptions if there's an outbreak or maybe there's a large event, but those should just be exceptions. The expectation is that tests should not be stockpiled. Schools will then receive the test and the services that they ordered. We need to make sure you get everything you receive. Hopefully your order is the same as your receipt, but if not, discrepancies are very important to document and track. Make sure your testing coordinator follows up with the vendor about discrepancies. After you receive the test kits and services, you then need to report. These are due 48 hours after receipt of the goods and services, and we're going to discuss today what must be submitted. DSHS will then use these reports to track the allocations. Those will be updated regularly by TEA so that school systems can monitor their expenditures and stay under their allocation. It's also a good idea for school systems to track their own allocations. We'll then move into the invoice reconciliation process. Once a month, vendors will submit their invoices, and then we, and by we, I mean DSHS, Texas Education Agency, and school systems, will work together on invoice reconciliation. State agencies have 30 days to pay invoices, and invoices paid after those 30 days accrue interest. If you're like me, I hate paying interest and late fees. So we want to be good stewards of tax dollars and not have to pay those on this grant. The reconciliation process starts with DSHS. We'll compare your test and services received reports to the vendor's invoices and the supporting documentation. If they match, that's great. Your school system is then off the hook for further assisting with the reconciliation process. But if they don't match, TEA will then contact the school system for their assistance in figuring out the discrepancy. There will be a short turnaround time for this process, so it's important to 1, report accurately, and 2, keep detailed records in case things don't match. So let's go over a few important details about the report. Here are a few good things to note. The link for the report is on the Texas Education Agency website. You only need to submit this report if tests and services are received. Reports must be submitted within 48 hours of receipt of goods and services, and delayed reporting will impact our ability to appropriately track use of your allocations and reconcile invoices. The date received is very important because this is how we tie the tests and the services to the vendor invoices. On the report, only products and services from one vendor can be submitted at a time. If you're working with multiple vendors, separate reports will need to be submitted. When you get into the report, you'll have to select the vendor you're working with. All of the subsequent fields in that report are going to vary based on the vendor. So selecting the right vendor will make sure that the right information is entered, and that will greatly assist us with invoice reconciliation. We've already seen a couple of instances of this, so we want to please make sure you don't select the wrong vendor just to meet the 48-hour requirements. If you have any questions or issues, please email tcecsupport@dshs.texas.gov. If that was too quick, don't worry, we'll show you that email address at the end of the presentation so you can jot it down. And of course, for those of you who've been reporting to us on the COVID case reports, all of the fields marked with the red asterisk are required. So let's go ahead and dive into the form. The first section of the form is school identification. If you're a public school system who's been reporting on the COVID public school case reports, this section is going to look very familiar to you. So the first field that you'll enter is the school type. This will either be a public school system or a private school system. You'll then enter your ID number. You can do this either by typing in the name or the number. For public school systems, this is the district number. For private schools, if you're accredited through TEPSAC, then it's your TEPSAC number. All other private schools were assigned a unique identification number that TEA provided to you. You'll then need to enter an authentication code. This number is also provided through Texas Education Agency. For public schools, this is the same number that you've been using for the last year for case reporting. If you're a public or if you're a private school, then this would have been recently given to you from TEA. The next field that you'll need to enter is the reporter email. This is very important because a confirmation email with details of the report submission will be sent to this person. And this is also the person that we'll contact if we have any questions about what was submitted. Only one email address can be entered. We then ask for a phone number. Again, that's if we have any follow-up questions about the questions on the report and what was submitted. There's then an opportunity for you to submit any comments. This is not a required field. If you have, if there's anything that's incorrect in the information that pre-populates when you put in your school information, you can note that to us. Or if you're having any other issues or comments that aren't urgent, you can also put those in reporter comments. And then we're going to have the big question: what vendor has this school system received test kits and products from? Only one vendor can be submitted per form. The next sections will vary depending on the vendor selected. For schools and districts who recently received Abbott by Next Now test kits, you'll note that there's not an option right now for a vendor from that option. We're working on that, and we hope to have that entered tomorrow. So if you recently received Abbott by Next Now test kits from DSHS and Cold Chain Technologies, just hold on your reports. We'll let you know when that's ready to go. Also, you'll note that Texas Division of Emergency Management, Tdm, is not an option. Any test kits that you've received directly from Tdm do not need to be reported on this form because those do not impact your current allocation. Now let's move on to the next section, Section 2, Testing Products. At the bottom of this section, you'll see that there is a checkbox where you can say no tests were received to report. So if you're just reporting staffing services, you can check that box. This section has two parts: rapid antigen test and PCR test. Let's start with the PCR test. So there's basically three fields for rapid antigen tests. It's going to be quantity received, the date the tests were ordered, and then the dates those rapid antigen tests were received. Please note that SDI rapid antigen tests are not currently available, so I've kind of grayed them out. But again, once you select your vendor, you'll see these different options that you'll need to fill in. This is one of the areas where we realize we can make this form a little bit more efficient. Because Quest Diagnostic and Achieve Health Management both ended up charging the same price for their rapid antigen test, we're actually going to condense these. We don't really care what brand you receive, since they're the same price. So we're going to get these changed so that, like if you're working with Thermo Fisher, it just asks for quantity of rapid antigen tests received rather than asking details by different brands. You'll then enter the quantity. Make sure that this is the number of test kits you received, not number of packages. So sometimes multiple test kits come within one package, but you're still charged by test kit. So make sure you put in the right number. Hopefully the number you received equals the number you ordered, but if not, make sure to enter the number you received. If you did not receive any rapid antigen tests, then enter 0. This will make the date fields disappear, and there won't be an issue with them being required fields. So date ordered, this is going to be the date that you formally requested these test kits from the vendor. And then the date received is the point at which the FedEx or UPS, whoever those came from, actually delivered those to your site. If there was a partial order, so say this vendor splits the order and there's 2 different shipping dates and there's 2 different receipt dates, then you'll need to put those on different forms. Now let's talk about the PCR products. The field options, again, are different, as you can see, by the different vendors. This is because the vendors bill at different points. So it's important to understand the terms for the vendor you're working with so that the invoice reconciliation process is easier. The first field is quantity. This is the quantity of PCR tests received. The definition of quantity is going to differ by vendor, and we're going to come back to that. You then will report date ordered. So again, this is simply the date when you formally ask the vendor to send you a specific number of tests and type of test kits. You then have the date received. And this is, again, the date that UPS or FedEx drops off those supplies on your site. As you can see, for Quest Diagnostic and Achieve Health Management, we actually have a 4th field that will need to be filled in. And these are the dates that those labs processed the specimens at the lab where they ran those tests. I'll explain why this is important when we talk about the different definitions in quantity received. We are looking at a few efficiencies in this form. We realize that there's a couple of fields that we don't absolutely have to have, but there's some technical back-end stuff that we're still trying to figure out how to take those fields off and not create bugs within the rest of the form. So hopefully this section will get easier as we go along. Now let's go back to quantity and talk about how vendors define that differently. So for SDI Labs and Thermo Fisher Scientific, quantity received is simply when you receive the test kits from the vendor. This one's pretty easy. They bill at the point they ship those testing supplies, so that's why the receipt date is needed for those two. On the other hand, Achieve Health Management and Quest Diagnostics don't bill for PCR tests until the test is actually run or processed by the laboratory. So the quantity you'll need to report if you're using one of these vendors is the number of tests that were sent to the lab, and then the lab ran those tests and gave you results. So let's look at a few scenarios for PCR tests. In scenario number 1, we have Sunshine ISD, who is ordered from Thermo Fisher Scientific. On the 1st of October, they requested 100 individual PCR test kits. They received them on the 5th of October. They were lucky here, the number that they ordered and the number that they received was the same. When Sunshine ISD comes to report the order that they received from Thermo Fisher, they're going to do that no later than the 7th, because that's 48 hours after the date that they were received. And they're going to report on PCR kits received, because that is how Thermo Fisher bills. So they'll report that they received 100 test kits, they ordered on the 1st, and then they received on the 5th. So let's look at a scenario if they ordered from one of the other vendors. Again, all of this information basically is the same. They ordered the same test kits on October 1st. They received the same 100 test kits on October 5th. However, in this case, they didn't use any of those 100 test kits until October 8th. On that day, they actually tested 25 individuals with those PCR kits. So they collected samples from 25 individuals on the 8th. They then packaged up those samples and sent them to Quest Diagnostics, who received and processed those 25 kits at their lab on the 9th of October. So how would the report be different? On this case, rather than entering the 100 kits received, they would only report the 25 kits that were processed at the lab. The order date would be the same of October 1st. The receive date would be, kits received date would be the same as October 5th. But in this case, they're going to report the date the tests were run or processed at the lab, and that was October 9th. Now, let's move on to the staff support received. In this section, you'll see a table for entry of the vendor staff support. If you did not receive any staff support from a vendor, please check the box at the bottom of this section that states no staff support to report. This section is only for reporting staffing support received directly from one of the 3 vendors, Achieve Health Management, Quest Diagnostics, or Thermo Fisher Scientific. If you're working with a different vendor for staffing support, you do not need to report those because that does not impact your allocation. Now, you'll note that on this, for public school systems, these first 3 fields are not required. Because of a technical reason on the back end of this form, we couldn't make these required fields, but trust me, they're required. If reports are submitted without these fields completed, we will follow up with you and ask you to resubmit the form, because we have to have this information to be able to move forward with invoice reconciliation. If you're a private school, your information is automatically tied in, so you won't have to need to identify any additional information in this section. Both public and private schools will start with the staff member name. So again, this is the staff person that the vendor sent out. We ask that you enter both a first and a last name so that we can tie this back to the vendor's invoice. You'll then enter the date that the staff member was on site. Only one staff member's name and one date may be entered per row. If the staff was there on site for multiple days, then that goes on a separate row. We'll also ask that you use the calendar feature rather than typing in dates. This will help reduce date errors. You'll then need to enter the minimum number or the number of hours that the staff member was on site. Hours need to be rounded to the nearest 15 minutes, and we'll show that on the slide next. The last field is record ID number. This is not anything you need to enter. This number will be automatically generated for each row when you save the form. When you get that confirmation email that I mentioned after you save the entire form, that number will be in that email. So if there's